लोग रेमेडीज देने से हटते नहीं है। नींबू में हल्दी डाल लो, तेल डाल लो सरसों का, एंड देन उससे ब्रश करो। आप ब्रश क्यों कर रहे हो? ये तो केमिकल है।
तो मेरे को डेंटिस्ट के पास जाने की जरूरत क्या है? मोस्ट ऑफ द पॉपुलेशन आई वुड से दे फील लाइक कि पेन थोड़ी हो रहा
They are proud of it. There are things जो आपके दांत पे डिपॉजिट होते हैं, we call it calculus plaque. You need to get rid of it ताकि आपके gums और bone जो है healthy रह सके। आजकल ये non fluoridated को बहुत promote करते हैं। No fluoride is not a good thing. In India, people don't do flossing. I'm sure they don't know even what is floss. One of my patients, I remember, I got goosebumps after that. She hugged me. She couldn't stop crying. What do you notice in people when you see them? 60% people notice smile. Dentists in India are underpaid. आगे वाला दांत मिसिंग है तो उनको बहुत फर्क पड़ रहा है। पीछे वाला दांत जैसे कि कोई बात नहीं, एक ही तो दांत मिसिंग है। बट आई वुड वांट पीपल टू नो कि इफ वन ऑफ द टूथ, एनी टूथ इज मिसिंग, जो साइड वाले दोनों दांत हैं वो शिफ्ट हो जाते हैं एंड ऊपर वाला दांत भी नीचे आ जाएगा।
टूथपेस्ट तो करना ही नहीं चाहिए, whatever it is. You should go back to your roots in a way कि आप cartoon करो. Welcome to Real with Ritesh, where we dive into real conversations. Today I'm joined by my schoolmate Dr. Sonakshi. Dr. Sonakshi, welcome.
Thank
It's
you
great
so
to
much.
have you here.
Same here, same feeling. Thanks for having me.
Right. So Dr. Sonakshi is expert in dental and smile makeovers. She is a certified professional in cosmetology, dental cosmetology, and she has great experience in celebrity smile makeover. I'm really looking forward to have this conversation to understand how she has been into this profession, and I think this will be the most suitable conversation because as a person, even I have some questions in my mind, like how to take care of my dental hygiene. And when you're raising your kids, you always have questions about those also. So it'll be a real and raw conversation, and I'm really looking forward to it.
Same here.
Okay, so Nakshi, I would like to start with one surprising fact about yourself that you would really love to tell people who are listening to you for the first time.
Okay, I am a dentist by profession. I'm an aesthetic dentist. I'm a mother, but I'm a gym lover. So
Okay.
I don't know if many people know it.
Right.
Like if they see my profile on Instagram, they might, but I'm a core gym lover
Right.
these days.
Great. So fitness freak,
Fitness, really.
as well as a person who loves to take care of the other people's smile makeovers, right? That's the perfect thing I want to say about. Okay, so the question is like, what brought you into dentistry? I've heard like मेरे ध्यान में मुझे ये लगता है कि लोग जब उनको मेडिकल सीट नहीं मिलती ना तो ये कहते हैं कि चलो यार डेंटिस्ट बन जाते हैं, तो ऐसा कुछ था या क्या स्टोरी है?
Same happened with me.
Okay.
Same happened with me. Like obviously, one of my friend, our classmate only, she asked कि Sonakshi नहीं होगा medical में तो have you thought about dentistry? I was like कि please यार, why are you asking this question? Like it was never on my mind. But eventually it was like कि I was left with no option. But later on, it became such a passion that you know now how
तो ये
involved I am.
सही फैक्ट है बेसिकली, मतलब जब किसी को सीट नहीं मिलती देन दे कीप इट एज अ बैकअप.
I think it happened with me. So
Okay.
I think more than 50%.
So ऐसा कोई जब आपने मतलब इसको अपना पैशन बना लिया तो ऐसा कोई चैलेंज या ऐसा कोई फेलियर आपकी लाइफ में आया हो which made you think like what it has impacted me a lot, now I'll conquer it, and उसके बाद आपकी लाइफ को लेके पर्सपेक्टिव ही चेंज हो गया?
So I'll tell you, after COVID hit, it hit us all bad. Clinics were all closed because you can't practice. I was then we started practice, but I had a small baby, so I couldn't go to practice, and I was like, will I be able to practice now? And then once she got a year bigger, and it was like a full transformation in myself. Like now I get up and then I sleep, and there's no sleeping time, no resting time, and I work whole day. I think it has changed me. Then talking about gym, how I loved it because it has given me more energy. Now I do everything. I manage my time so well, and I work so well with such a healthy mind and such a healthy physique that I had a back pain after motherhood, postpartum things. But now, like, I feel so good in myself. My body is allowing me to do everything. My mind is allowing me to do everything. And it's such a good feeling.
Right.
I think it's such a good transformation.
So I think you said it very right. So for every working woman or working mother, I would say it's better to take care of yourself first,
Yes.
right?
And I've learned it recently, like in these 2 years. एक चीज मैं बताना चाहूंगी, जो भी मदर सुन रही हैं, जो भी फीमेल्स लाइक दे फील कि वर्कआउट वॉक कर लिया इज गुड, इवन नॉट फीमेल्स लाइक एवरीवन, strength training, I don't know if you can, it's a good thing to talk here, but strength training is so important. To have a good muscle is so important कि वो आपका जो भी आप कर रहे हो ना उसमें बहुत अच्छा हेल्प करता है, एंड फॉर द लॉन्ग रन, फॉर योर how you age, it's such a good thing.
Right. You stay active.
Yeah,
it's a sort of
to
active
stay
lifestyle.
active, to stay active.
Right. I have a question which is not relatable to this. I think you said right कि strength training की बात करनी चाहिए कि नहीं चाहिए. I'm also waiting for somebody coming from that background जिसको मैं question पूछ सकूं. There was a quote I read very recently. If you do gym, if you do strength training, you won't get old anyway because you die early. उन्होंने ये बोला था, तो that was a funny quote. I really want to ask her help.
No, I don't know if I'm a good person to answer this. So the thing is, जो gym जाते हैं, so there are two things. एक तो आप active होने के लिए जा रहे हो, एक आप hypertrophy कर रहे हो, या आप muscle build कर रहे हो at any cost. And then जो ये programs हैं, जो ये competitions हैं, if I know, they are on really bad state, like they don't take water for 2 days and this and that. That is unhealthy, but I don't know competition wale how they how they manage and what is the criteria. I don't know. I am not a good person to answer, but I'm just saying in a normal general way. I don't take caffeine, I don't take pre-workouts, I'm a vegetarian. So you can be healthy in a normal way. You just have to sort out your proteins and everything. But
तो किसी भी चीज को extreme ना करें.
extreme नहीं करो. But ठीक है, उनका अपना profession है. Who am I to talk about that? कि ये नहीं खाओ या दूध.
Okay, so if I have to ask you, like, if you go back in your life and you are able to talk to yourself who's 18 years old, so what advice you'll give yourself?
Okay, so now I am into skin cosmetology also. I'm a facial esthetician. I would say कि I was not using sunscreen by then, and I was in high sun exposure. So now I would say कि sunscreen सबको लगानी चाहिए.
Okay.
Like, and dental ka, if I say, I had a crowding in my lower teeth. I got my Invisalign done later on. If that would have been an option earlier, I would have done it earlier.
Any moment from your professional life that a patient or a client has taught you something in a very good way कि वो आपने अपनी life का, I would say, you have made a standard.
I think every patient taught us every small things. कोई भी what we are today, we are a collaboration of what small things we have learned from patient. But one thing which has really impacted me is there was a old lady, I would say old, because she was 85, and believe me, like she started her law journey in 65. Like she started studying law at 65.
Okay.
Because her husband was into law, and वो बोल रहे थे कि मुझे ये चाहिए रूम से, and he was like कि आप जाओ बाहर, please get out, I'm doing some work. She got so disappointed. उन्होंने बताया भी नहीं उनको कि मुझे, I mean, I felt bad. She just started studying law and she became a lawyer. Now she came to for a smile makeover. She got implants and crowns and everything done. Full on smile makeover she got done, and she was like, now it's time I'm investing on myself. And उनके साथ जो आए, they were also old, like 60s में थे वो भी, and they were her she was mentor of those ladies.
Okay.
It's so inspiring. At any age you can do anything, and that too with so much zeal and energy.
I have seen some of the students. My profession is like I talk to students a lot, right, for international education and all that stuff. I sometimes feel like students lack motivation. Like if you suggest them, you can do this. This is a better course or something like that. they're always like, नहीं इतनी नहीं पढ़ाई होगी. I think this is a real motivation on that. But somebody at 65 is becoming a lawyer. Wow.
And
Okay.
now practicing till date, like
Hmm.
she's practicing and so well she's doing.
आप celebrities के साथ भी बहुत काम करते हैं. I've heard a lot, I've seen a lot, like many celebrities coming to your clinic, right? My dentist, that's the name, right?
Yeah, Dr.
So well,
Mogla
that
is my dentist.
Dr. Mogla's my dentist. So what is the difference? Like I want to learn from a layman, right? So if you handle a client who's coming from a humble background, a normal background, a normal, daily routine, and if a client is coming as a celebrity, like what's the difference you feel in that?
देखो earlier तो I used to get goosebumps कि अच्छा वो आ रहे हैं
Okay.
celebrity to be very honest मतलब but now it's like they are we have met them so many times so many celebrities we have worked on and it's a good learning experience some are very very humble you get to learn from them only कि you are at such high when people have you have such a good huge following and then even you are so humble and um, there are some influencers who who are not still in that state but they are not so humble and they are like कि हम कुछ हैं so it depends upon कि आप पर्सनली कैसे स्टेट ऑफ माइंड से आते हैं बट पर्सनली मुझे जितने भी हमारे पास जितने भी सेलिब्रिटीज आए हैं दे आर लाइक so good with us.
Right, right. Okay. And when it comes to, hygiene and you're taking care of your dental health, there are some online trends. There are some, things going on online. You try to scroll, कुछ ना कुछ आपको ऐसा मिल जाएगा. You feel like, हाँ, you feel like यार ये तो इतना आसान है. मतलब ऐसा कोई आपको लगता है कि मिथ है, लेकिन इतना बहुत पॉपुलेट कर दिया गया है कि लोग उसको रिलाई करके उसके बिहाफ पे कुछ ना कुछ ऐसी चीजें कर रहे हैं. So what is that? I would say moment जहाँ पे आपको फील हुआ हो like so dissatisfied कि you are from that profession and this is something beyond
क्या
basic
मैं
understanding.
आपको 3-4 चीजें बता सकती हूँ
100% looking forward to it.
तो पहला है कि लोग रेमेडीज देने से हटते नहीं है दे डोंट नो कि इनामल डेंटिन पल्प टूथ का एनाटॉमी क्या होता है बट देन दे आर लाइक कि आप ना नींबू में हल्दी डाल लो एंड तेल डाल लो सरसों का एंड दिस एंड दैट वी हैव हर्ड अ लॉट ऑफ टाइम आपने भी सुना होगा एंड देन उसको उससे ब्रश करो आप ब्रश क्यों कर रहे हो ये तो केमिकल है दिस एंड दैट बट वो आई मीन आई फील सो बैड कि आप किस किस को समझाएंगे बिकॉज दे हैव सो मेनी फॉलोअर्स कि आप क्यों गलत गाइड कर रहे हो लोगों को नमक इट इज अब्रेजिव जो भी वो चीजें बताते हैं बेसिकली वो घिसाने वाली चीजें हैं अब्रेजिव यू दे हैव दैट पार्टिकल या कंटेंट सो द थिंग इज कि जब आप उसको अपने दांत पे you'll rub on your teeth it will cause harm to your enamel it will damage your gums and obviously हल्दी है तो वो आपके टीथ को स्टे नहीं करेगा वाइट तो करेगा नहीं देन देर आर चारकोल वाइटनिंग टूथपेस्ट का ऑब्सेशन कि वो उससे वो दांत वाइट हो जाएंगे देन एंटी सेंसिटिव टूथपेस्ट का भी ऑब्सेशन है कि हम तो सेंसोडाइन करते हैं बिकॉज उसकी एड आती है ठीक है इट्स अ गुड थिंग इफ यू हैव सेंसिटिविटी और आपको डॉक्टर रेकमेंड कर रहा है माई पॉइंट ऑफ saying anti-sensitive toothpaste ka because when you have any problem and you're not addressing that problem the root cause and you're just subsiding the anti-sensitive thing तो आप later on आप harm ही कर रहे हो अगर you have a cavity आप उसको जाके fill नहीं करा रहे and then you are doing your anti-sensitive से anti-sensitive वो relief ले रहे हो but later on tooth won't come back the cavity won't stop that's my point.
You're very right on this. I think especially in layman people feel like मतलब मेरे को डेंटिस्ट के पास जाने की जरूरत क्या है. I think most of the population I would say they feel like कि पेन थोड़ी हो रहा है क्या ही हुआ है मेरे
they are proud of it they when they come to us with some pain that the डॉक्टर साहब इतने साल हो गए कभी लोड़ ही नहीं पई I mean we never felt like coming to a dentist and they're proud of it and I'm like this is not a proud thing to say कि आपको जरूरत ठीक है आपको पेन नहीं है which is a good thing आपके दांत कहीं के हेल्दी भी होते हैं ऐसा नहीं है but you need to have a regular checkup why do you need a regular checkup because जो देर आर देर आर थिंग्स जो आपके दांत पे डिपॉजिट होते हैं, वी कॉल इट कैलकुलस प्लाक, यू नीड टू गेट रिड ऑफ इट ताकि आपके गम्स और बोन जो है हेल्दी रह सके फॉर लॉन्गर पीरियड ऑफ टाइम। अगर आप 20s में प्रॉब्लम फेस कर रहे हो आजकल के टाइम पे, तो इमेजिन कि कितना लेटर ऑन आपको क्या दिक्कत आने वाली है।
You're very right. I think I have a reference case in my mind. One of my known, उसके baby, I think 6-7 years old, he has to go through RCT. So this is happening at this age. मतलब I think when we were growing up, तो ऐसा तो कुछ भी नहीं था कि RCT हो रही है छोटी सी एज में. तो ये क्या issues हैं मतलब daily life में?
I think diet has also a big impact. बाकी तो देखो जेनेटिक्स एनवायरनमेंट दे ऑल मैटर। अब कईयों का जेनेटिक्स बहुत स्ट्रांग होता है, दे डोंट टेक दैट गुड केयर, इट्स ओके। देन देयर इज एनवायरनमेंट में हाउ डू यू टेक केयर ऑफ योरसेल्फ, हाउ योर वाटर इज, डज इट हैज फ्लोराइड, फ्लोराइड इज अ बिग थिंग, आई वुड वांट टू टॉक अबाउट दैट बाद में। बट ये सारी चीजें इम्पैक्ट करती हैं कि आप नाइट ब्रशिंग कर रहे हो, आप ब्रशिंग कैसे कर रहे हो, आप किसके साथ ब्रशिंग कर रहे हो, एंड देन हाउ इज योर स्नैकिंग हैबिट। अगर आप ब्रश भी कर रहे हो एंड देन यू आर ईटिंग 7 times a day, जो कि किड्स में इट्स वेरी कॉमन, तो एंड इज द फूड स्टिकी, how long you're taking to have that food, the duration you're keeping your food, all that matters. It's not a single thing, जैसे कि 2 बार ब्रश कर लिया, कुछ होना नहीं चाहिए, ऐसा होता नहीं।
तो बहुत small things हैं जिसका ध्यान रखना चाहिए। Yes. I want to ask you from my personal side, I think it will relate to a lot of parents too. So my daughter is 2.5 years old and we try to take care of her like anything. मतलब every parent does the same thing, right? Yeah. So as you said कि 2 टाइम ब्रश कर लिया तो ठीक है, तो मतलब हमें भी कई बार ये लगता है, we try to उसको बोल देते हैं गार्गल कर लो every time you eat and then brush 2 times a day. Yeah. तो ये चीजें हम कर रहे हैं, are we going the right way or there is something that we as laymen don't know which as professional you know? तो कुछ उसके बारे में हमें बताइए।
Yeah, so basically kids should be doing brushing with fluoridated toothpaste. Okay. आजकल ये ads भी बहुत नॉन फ्लोरिडेटेड को बहुत प्रमोट कर देते हैं कि दिस टूथपेस्ट, जैसे कि वो पैराबिन, नो पैराबिन, नो this and that, no fluoride. No fluoride is not a good thing. Okay. It is only you can start you can do non-fluoridated because kid doesn't know how to spit, and then you can teach them the way with non-fluoridated, and then you have to shift to fluoridated even if the kid is 2 years. 1.5 year, 2 years.
Fluoride जो आप कह रहे थे बात करनी है, I think that is an important thing.
अच्छा, and now comes the professional part of fluoride, जो कि I would want कि सबको करवाना चाहिए for kids आजकल के time पे, because we don't want our kids to suffer. So there are two things which come in preventive dentistry, जिसमें cavity होता ही नहीं है. Number one is fluoride varnish. Okay. So वो हम 3 years के बाद करते हैं. It's basically a nail coating type of a texture जो हम सारे दांत पे अप्लाई कर देते हैं, and then kids are safe for longer run. Cavity prevention में help करता है दांत के. Then there is pit and fissure sealant, जो कि हम पीछे वाले molars में on the top surface करते हैं, जो हमारा fissures होते हैं, grooves होते हैं, उनमें हम उनको seal कर देते हैं. It has a good amount of fluoride and वो कैविटी नहीं होने देता. एंड बिलीव मी, 10-10 साल के बच्चों में हम रूट कैनाल करते हैं, जैसे आपने 6-7 की बात करी, तो बहुत कॉमन है एंड इट्स नॉट अ गुड थिंग कि बच्चे सफर करें. तो कराना पड़ता है, फिर पेन भी, फिर इट टेक्स gets little messy with them.
So with your advice, I think preventive measures अगर लिए जाएं तो it can be avoided rather than delayed. Sometimes ये कहते हैं ना कि हम सिर्फ डिले कर रहे हैं चीजों को, ऐसा नहीं है. A reference to this could be like nowadays people are more aware that we should get a full body checkup, we should get tests every year, we should get checked up every year कि क्या internally medicine की हमें कोई जरूरत तो नहीं है. So I think that practice should also be with dental practice, right? Every 3 months or 6 months. What do you say on that?
Totally, we advise कि आप 6 months बाद dental checkup कराएं. Some patients have very good hygiene and very good maintenance. Then we advise कि आप 6 to 1 year is also good for you. But on an average, we say 6 months. After 6 months, you should have a checkup, and if you need a dental cleaning, because this is something which should be done professionally.
Right.
वो अगर आप करा लें तो you can be safe for the longer run. And then when patient comes to me, I just don't check, and I do proper brushing. How do you do brush? With which toothpaste? I do a lot of oral counseling. And then in India, people don't do flossing. I'm sure they don't know even what is floss. I ask, do you floss? With so many people they don't know about it. I teach them floss, and I teach the ways with which they can do floss. And in one session, if they don't feel motivated on the follow-up, I say,
Right.
have you started flossing? So I think after meeting and after keeping in touch with the dentist, you can develop good habits for the longer run.
So we were talking about fluoride, non-fluoride. I think मतलब मैंने भी कहीं शायद ऐसा कुछ देखा, कंटेंट ही देखा है. There are codes on the back of your paste, which is red, green, blue. वो मैटर करता है. Something ये कुछ genuine है?
People अभी भी बिलीव करते हैं कि जो ग्रीन मार्क है दैट इज फॉर नेचुरल, और जो ब्लैक है वो कुछ केमिकल है उसमें. ऐसे बेसिकली वो पैकेजिंग का देयर इज सम पैकेजिंग के टाइम पे कलर कोडिंग है. Ideally, what you should be seeing in your toothpaste is it should have a fluoride anti cavity prevention के लिए जो भी necessary होता है ना वो. Then how abrasive is the toothpaste? Normally जो भी herbal toothpaste अगर आपको अच्छे लग रहे हैं, believe me, वो ही ज्यादा बुरे affect करेंगे, because उसमें abrasive content बहुत ज्यादा होता है. We can't take the names, but जितने भी आयुर्वेदिक herbal नाम से mostly बिकते हैं, I wish I could take the name. So वो बहुत ज्यादा bad effect करते हैं. So what you're gonna get later is the sensitivity, because आपका जो top layer है enamel का वो loss हो जाता है, because that hard layer is you're rubbing the enamel off with that toothpaste. Okay. And people, they brush also very hard ना.
वो मानते हैं ना कि जितना स्ट्रॉन्ग करेंगे उतना क्लीन ज्यादा
होगा. हाँ, क्लीन, बट ये उल्टा इफेक्ट करता है, आपके इनामल को लॉस करवा देता है, एंड देन यू फील सेंसिटिविटी, योर गम लॉस हैपन, योर बोन लॉस इज हैपनिंग. आई
थिंक द मोस्ट प्रीशियस थिंग, आप कभी भी उसको रगड़ के साफ नहीं करोगे. इफ इट इज अबाउट एनी पीस ऑफ आर्ट कह लो या कुछ कह लो, you'll take care of that, right? It should be like,
I'll give these kind of reference to my patients now.
Okay.
You taught me a thing.
That's great. But I think content is playing a greater role. The way we are doing this also is for the awareness of the people, like they should take care of their dental hygiene also. When it comes to content, I've seen also many influencers, or I will not say influencers itself, just the content, I would say. Content is going in a way that feels like ये तो बहुत easy है, like 3 hacks, 5 hacks to do this, 2 hacks to do this every night and you'll have the great teeth of ever, ऐसा कुछ चलता रहता है. So do you feel there should be a relevance, a reference to some professional before doing those sort of things?
I think जो भी प्रोफेशनल, उनके पास इतना टाइम नहीं है कि इतने हैक्स बनाएं. लाइक इवन आई फील कि मुझे अवेयरनेस करना है, बट वंस इन अ वीक और ट्वाइस इन अ वीक वी गेट टाइम. But influencers, they have that work. I think they should be referring to someone and then do, rather than doing it for the views. This is all what I want to say about this, because जो भी normal audience देख रही है वो आपको follow भी करेगी, and you should not be teaching the content कि वो आप ऐसे वही brushing की बात कर लो या ये hack कर लो, क्या वो pulling, oil pulling. So one of my celebrity friend only sent me a reel in the morning. Is it okay if I do this? And I mean, it has something in it that you should be doing, but you should not be skipping it. Teach them everything, na. Like teach them how to brush, what is the right time to do it, and how do you manage after that. And is oil pulling doing everything and not going to dentist? Say in a disclaimer,
right,
ye karo, it has some effects,
yeah.
But teach them other things also.
Yeah, you're right. If they are in need, तो वो तो खुद dentist के पास ही जाते हैं ना. They are not, getting their self treated by that.
Exactly.
So बिल्कुल ठीक है. So when you are into cosmetology, you are taking care of dental smile makeovers and also helping them with, I think it boosts the confidence. आपको internally वो अच्छा अच्छा feel होना शुरू हो जाता है. So any story, any I would say client that you have helped them, उसके बाद उनकी life totally change हो गई हो.
So there were some girls, because brides के लिए it's very important. We have seen the marriages happening so quick. I think जितना मर्जी कह लें कि हम appearance नहीं matter करता. We try to self do that. You look good only. But ठीक है, when they feel good inside, good confident inside, so it boosts up their overall confidence, which is obviously an add-on to their personality. And one of my patient, she was into her 50s only. She got a smile makeover done. Then she reduced her weight. It was a like then skin thing. Total transformation journey we saw in her like within 5 months. And it was such a good feeling in myself that see how you started that confidence thing, and how it became a journey in itself. Some people, they feel like they start crying after seeing the parents, because they wanted it from so long. The stain on the tooth after they get veneer, and one of my patient, I remember, she was like, I got goosebumps after that. She was like, she hugged me, she couldn't stop crying. So we have seen those journeys.
Right. And do you believe it really impacts the real life? मतलब एक होता है कि वहाँ moment पे हम enjoy कर रहे हैं, okay, I have transformed, I have changed, I got confidence. But do you personally feel that it impacts for long time?
जब वो कॉन्फिडेंस साथ लेके चलेगी, फिर कैसे इम्पैक्ट नहीं करेगा.
Right.
जब वो माइंड मेकअप भी वैसा हो जाता है, नाउ आई तो लुक स्टनिंग नाउ दिस आई वांटेड, नाउ आई गॉट इट डन. It impacts their job, their real lives, obviously.
Right. People say like first impression is the last impression. Yeah. And the best thing to make first impression is smile, right?
Yeah, you got me right. Actually, it's not just saying, it's a study.
Okay.
So it's a study that what do you notice in people when you see them. So it's 60% people notice first the smile.
Right.
And then the eyes, the hair, then the overall look. And it's proper study.
Right.
You can see on the
Right. That's why, like, even in interview preparations, like if you talk about professionals who want to grow in their career, it's always said like once you enter the room of the interviewer, give them a sweet smile and say good morning or good afternoon. It starts with smile.
Yeah,
so I think if somebody is not feeling good about his or her smile, they should go through like, okay, यहाँ पे मेरा question ये भी है, like smile makeover. When we say this, it felt like this is something to be done by celebrities only. ये आम लोगों के लिए नहीं है. Like, is there any misconception around it?
Total misnotion. Nowadays, if you see smile makeover, everyone wants to have a good smile. जैसे हमने बोला, everyone wants to look like a model. Everyone wants to feel like an influencer and be an like Sabbir bhi bana rahe hain, so an actor also. Who doesn't want a good smile nowadays? So smile makeover is for everyone. Simply. Earlier तो ये था ना कि there was no this camera thing. अब तो everyone is
right.
has a camera, has a IG or जो भी page and doing stuff, and everyone is that level कि हम कोई celebrity से कम. I think कोई भी नहीं अब. They're all same.
Right. Everybody is a star.
Everyone is a star. Yeah.
So when we say like it's a misconception, like it is for everybody, there comes a point like people might think, I think they feel like it is very costly. कुछ भी dental treatments की बात कर लेते हैं. Smile makeover तो फिर एक बड़ी चीज आ गई. So dental treatments भी बड़े costly होते हैं that people feel, and I think that could be one reason that people are not going for preventive treatments just because it's costly. So from layman it's costly. From professional, what do you feel about it? Is it really costly?
देखो, अगर हम प्रिवेंटिव की बात करें तो पीपल थिंक कि हम क्यों पे करें जब हमें प्रॉब्लम हुई नहीं है. तो दैट इज अ माइंड दैट इज चेंजिंग नाउ. वी आर सीइंग इट चेंजिंग. अगर हम एक्चुअल ट्रीटमेंट की बात करें तो आई थिंक डेंटिस्ट इन इंडिया आर अंडरपेड, मच अंडरपेड. अगर आप देखो एनआरआईज जो भी दे come to India, there's a good dental tourism happening in India. Why? Because dentists are doing so well. Labs, technicians जो भी हमारे बैक एंड पे काम करते हैं, they are doing so well in India, and we are doing it much faster, much efficiency से काम कर रहे हैं. And जो भी बाहर जो भी डेवलप्ड कंट्रीज हैं उनके डेंटिस्ट या व्हाट वी आर चार्जिंग इज there's so much of difference. Right. And still people in India they complain ke dentists are costly. So I would want to add ki see if you should be paying for the dentist skill. Agar dentist has learned over the years to operate an air rotor जो हमारा simple जो हर प्रोसीजर में ही काम आता है रोटर, दैट वर्क्स ऑन सो मच ऑफ आरपीएम, और उसको इतने छोटे से दांत में हाउ डू यू प्रिपेयर विद सच clarity and efficiency. So I think you should be paying for the skill. You should be not just seeing the chair. You should be seeing कि material बाहर से import होके आ रहा है. We are paying so much on materials, sterilization, assistant staff, and ambience to make the treatment comfortable and painless. Earlier it was like happening and doing. Now the people want luxury thing. You have to pay for the setup. You have to pay for the dentist in an overall thing.
You're very right. When you said about these NRI customers, dental tourism, I want to add on something. There's a saying in Canada. I come from Canada, तो वहाँ पे ना लोग आपस में बोलते हैं यार ये ना दांत दुखना शुरू हो गया, लगता है इंडिया जाने पड़ेगा, right? And people, like it's a very real thing what I'm telling you. People say कि जितने में यहाँ पे मैं अपना ट्रीटमेंट कराऊंगा उतने में मेरी वेकेशन भी हो जाएगी और I'll have the treatment. Right. So when NRIs come to you, for treatment, what is that, I would say concern if they could have any before choosing a dentist here? Like if I would say like I have to come to India to get my dental treatment. Of course I come from India, तो मुझे ध्यान होगा, मेरे references होंगे, links होंगे. But think of somebody who has born and brought up in that Western world. That person has got something in their tooth and they want to get it treated. So as you said, it's about luxury, it's about experience, a lot of things in practice. So what according to you should be the checklist for those NRI customers who are coming to India, and as per that checklist, why they should come to you?
I think the checklist is very personal for them. Sterilization is must. I think many of the people when they talk to us, they call us and then they take appointment. We give virtual consultation first, and then when we talk to them, they're like, "Doctor, we are really scared." Like there also we paid for the consultation, but we are really scared. So I think mostly nowadays वो scare जो चीज है, if you feel that doctor is matching with your vibe and they're listening to you and you have seen their work, like they see us on Instagram and they see how friendly and how we actually warm with the patient. Not we want to show, we feel that way.
Right.
So they kind of connect to us in that way. So if you want to have that environment, you have to have good treatment in a shorter period of time. So वो आपकी checklist उस हिसाब से you can, but sterilization and no compromise on treatment should be on the top.
I think people have that sort of mindset कि Western world के अंदर it's more about the following the procedures, following the protocols. तो वहाँ पे cleanliness कह लो या hygiene of the environment of the room जहाँ पे वो treatment हो रहा है ये ज़्यादा है. और I think if I have to put it in a word, like people say कि यहाँ पे ना डॉक्टर थोड़ा सा concerned and caring होते हैं ज़्यादा. यहाँ पे जिसके जो मन में आए वो कर देता है. So that is a gap, I would say. तो क्या understanding है इसके बारे में?
I think it has changed now. When people, I don't know about others, but when NRI patients they come to us, they have a different thing what you're saying. They say that we didn't feel that comfortable. There was all paperwork and all. I mean, I'm sure they are doing so well, but we are no less. We Indian doctors who are doing good practice, we are no less.
So when I ask you this, I have another thing in my mind too. One of my friends, he got a treatment in Canada. So he was going through pain, like he tried his best. He's a doctor by himself, like, right? Nice. So he was there and he was like कि मुझे treatment चाहिए. He tried himself एक दो दिन कुछ ना कुछ करके देखते हैं pain killer and all that stuff, but it didn't went well. So he went for the procedure and they recommended for RCT. And imagine, I think there is numbering of the teeth. I'm not that professional, but it's like sixth or seventh or है ना ऐसा numbers होते हैं. So he said like it was in his seventh teeth on the upper side when doctor did the RCT, so वो 6वें में कर दी उसने. So that sort of mistake has happened in Canada itself, right? So you're very right. It has been changing, but I think human error can happen anywhere. इतना नहीं होना चाहिए पर मुझे लग रहा. So he was like, what has happened? एक healthy tooth मेरा वैसे ही RCT हो गया हुआ है and you know the another one is still in the pain. But people when they're coming here, I think they can be more comfortable and confident because
even we have so many friends who have been working, so ऐसा blunder तो नहीं हमने recently कभी सुना. College में होते थे तो there were students doing mistake, वो समझ में आता है, but professionals doing this not understandable.
Right. Any transformation could be smile transformation or a skin transformation. We are in cosmetology also, which has changed the life of somebody and how it has impacted you as a specialist or you know impacted you practically.
Like as I told you, there are every patient teaches us in a different way. So smile journey की बात जैसे मैंने बताई, there are a lot of souls like I connect to and they're like the confidence and then how they're still connected and how they are now into work life and now how happy they are in married life. I think there are many examples of that.
And people are always you know curious about knowing how celebrities are managing their dental care. So any memorable story from a treatment that you did for celebrity?
Like there was I सारी memorable ही होते हैं. But celebrities का like what comes into my mind कि जैसे shoot था, there was one Punjabi actor, I won't take the name. तो वो रात को पूरी रात में पेन में थे and he said कि मैं pillow क्योंकि he had pain in the tooth, then he searched on the net and because वो pulp pain होती है and he could know कि it's a pulpal pain जो दांत की and it's very bad. They say that it's very bad, then it's even bad than a heart pain. Okay. जो dental pain वो जो people experience करते हैं ना, they say. He said कि मैं pillow ऊंचा करके रखा राती सुता. Then morning within the shoot time he came and then after he got his root canal done from Dr. Sile, he's an endodontist, my husband. Okay. So he got his root canal done from him, and then it was done in a single visit, and he was good to go. I built the crown in the same day because he had a shoot, and it was not even noticeable. He has gotten something done. He was relieved of pain, and then he went back to the shoot. Okay. It was such a memory, and he came with all the crew and right. Yeah. So a lot of people came to you on that day just to get you know that treatment for the celebrity, right? Yeah, because they were all together for the shoot. So we had a lot of fun then. Right, that's great. So coming to this point about you know having your personality, having a confidence in yourself, what would you say to people, or like what's your perspective about it? Like if beauty or confidence is something that you can acquire, or is it something that is already in there but you just have to nurture it? Obviously, everyone is beautiful. Everything that God has given you is beautiful. But see, if there is something, if you can enhance it and you feel more confident, then why not? But एक चीज बस मैं ऐड करना चाहूंगी, सम पीपल दे जस्ट बिलीव कि सामने वाले दांत जो ये हमारे दिखने वाले दांत है वो सुंदर हो, और बाकी तो कुछ फर्क नहीं पड़ता। एज एन एस्थेटिक डेंटिस्ट आई एडवाइज कि वाइटनिंग तो हम कर ही लेंगे, आप पीछे जो आपका क्राउन, रूट कैनाल क्राउन होने वाला है, बिकॉज टूथ इज कम्प्लीटली डैमेज, व्हाई डोंट यू एड्रेस इट बिफोर यू गेट योर वाइटनिंग डन, बिकॉज दैट मैटर्स मोर आई थिंक। सुंदर लगना तो है ही, हम कर ही लेंगे, but functional restoration is very important, which people forget sometimes, कि अगर एक missing पड़ा है, so I would want to add, some people they say आगे वाला दांत मिसिंग है तो उनको बहुत फर्क पड़ रहा है, पीछे वाला दांत they say कि कोई बात नहीं, एक ही तो दांत मिसिंग है, but I would want people to know कि if one of the tooth, any tooth is missing, जो साइड वाले दोनों दांत हैं वो शिफ्ट हो जाते हैं at their position, at that tooth position, and ऊपर वाला दांत भी नीचे आ जाएगा, and the whole bite get disturbed with only one missing tooth, and everything get complicated, your bite got destroyed. So the thing is you should be addressing, अगर कोई damaged tooth है, चाहे कोई cavity है, चाहे कोई worn off tooth है, उसको address करो। आजकल तो वैसे भी बहुत सारा एडवांसमेंट हो गई है। If you have a damaged tooth, you can replace it, you can extract it, you can get it extracted and replace it in a single session. That we call it as immediate implants. So, in dentistry has gone so much advanced. People, NRI normally they ask कि कितना time लगेगा, and we say कि कहते हैं हमारे पास ना सिर्फ 15 दिन ही है, and sometimes we, what is our answer is कि इतने में हम 2 बार कर लेंगे. So it has gone that fast, that beautifully advancement has happened in dentistry.
Right. So there's a solution to everything. That's what sort of thing, right?
And beautifully. It's not that something we're compromising on. That's why I'm repeating the word. कि हाँ, root canal is single visit. हाँ, in some cases we don't do it because we need it to heal and rest. We advise कि multiple में हो. But if in some cases we have recently posted, we have done एक इवनिंग थी, तो 7 रूट कैनाल्स इन दैट इवनिंग, एक पेशेंट की 2 है, सिंगल विजिट, ऑल इन सिंगल विजिट, वो बाय चांस दे वर सुटेबल फॉर एसवीई, एंड इट्स हैपनिंग इन डेली रूटीन, so nobody wants to come 3-4-5 बार।
so वो जो old notion है people like कि 3-4 बार जाना पड़ेगा, वो चीज अब नहीं है, advancement is there, so people should be confident about it. So as a professional, do you feel that pressure on yourself also, like when you come across social media, when you post content of yourself, like do you have that pressure कि मुझे भी अपनी smile का ध्यान रखना है, और I have to take care of all other things to look better on that?
So smile का तो देखो, we as a dentist, if I don't follow the proper oral hygiene thing, who else gonna follow me? Who else gonna take my advice? So I do brush properly, I do floss properly. And for the overall look, if we are talking about, I don't take that pressure. I mean, I think we should look decently, naturally good enough, but I don't take that pressure कि आप ये dress repeat नहीं कर सकते. I don't.
Right. So any sort of conversation within this industry, within this dental healthcare industry, that you feel like should be, talked about, should be addressed to, because there are some concerns which are not outspoken already?
I think जैसे कि हमने डिस्कस किया कि डेंटिस्ट्री को बहुत कॉस्टली पर्सपेक्टिव से देखा जाता है, एंड पीपल दे स्ट्रेट अवे आस्क कि इसका क्या कॉस्ट होगा, उसका क्या कॉस्ट होगा, एंड there is a thing that everyone has a different kind of practice. We can set a standard cost to a practice, though there are associations कि इतना minimum होना चाहिए, but then I feel at in my perspective, जो भी हम relate करते हैं, the cost point of view, that should be like dentists are underpaid, and I want to make people know that the skill and what we have should be valued.
The precision, the care, the procedures, they involve a lot of resources, so it should be considered in a way, right? From the client perspective, मैं मतलब एक funny सी चीज पूछना चाह रहा हूँ. I want to ask any weirdest request or any funny request you have got from a client.
So I was in gym only.
Okay.
One of my gym mate, she called me up and she was like कि मेरे husband को I don't know if I can say. चलो let me talk about it. So she said कि मुझे मेरे husband को crown fix कराना है. उनका crown निकल आता है. So आप कुछ solution होता है इसके लिए वो दे दूँ हमें ना तो he'll fix himself.
Okay.
And I was like कि ma'am he'll not be able to do it. Like I was very polite. Though at gym you are in different zone because आप सारा दिन काम करके आए हैं. Then even then I was very politely I said कि ma'am वो एक solution ऐसा नहीं होता. We have to mix a certain amount and how we are mixing that also matters.
Right.
And then why would you pay for the whole thing? But you just need this
one.
amount and why don't you go to any dentist? He said कि मैं every time I'm paying it keeps coming off. चलो वो जो भी था. And he was like कि कहाँ से आप भी तो कहीं से लेते होगे ना. I was like कि आप net search करो because I was like कि please understand कि dentists are eligible to do this.
Right.
What if it gets fixed in the wrong position? You won't be able to close your mouth. And then there was an NRI patient उन्होंने भी कहीं से कराया था. And then with some reference they got to talk to me and they were like कि मुझे ना solution भेज दो जिससे crown हमारा वहाँ निकल गया. I know it's very expensive out there, but please understand you cannot fix your crown yourself with those solutions. It's not a gum with which you can fix your teeth. So
it's a professional task.
there are we have been taught the structures कि इसका क्या structure होगा, इसका क्या acid होगा, क्या reaction होगा, and how you can't mix like this. You have to go this motion.
Right.
We have learned over the years period of time. Sometimes I don't. In some cases, I don't even allow my staff to do this. Who does it every day? कि ये मैं आज मैं ही करूँगी. Because I know some things can be tricky. How can you be a doctor for yourself?
So saying no would definitely be hard. I think आप बहुत सारी ऐसी situations में आए होंगे already.
I kept on thinking for like 5 minutes कि क्या ही state of mind रहा होगा.
ऐसी कोई situation celebrity के साथ हुई कभी like where you had to say no for their best interest?
हाँ मतलब वो that was in a good way only. Like one of my celebrity actor, she had a shoot. वो हमने plan करा था whitening का, but then उनका shoot था for some scary movie. So they had to do it all black in between. So then we got to talk and then we both decided कि हम बाद में करते हैं. So that way it happened.
And any practical advice that you want to give to the listeners and audience that they can practice within this week to feel some difference in their confidence and smile?
Practice, I think hygiene पे सबसे ज़्यादा बात हम कर रहे थे. तो hygiene they should be following. Morning night brushing is even more important. Start flossing. Go to your dentist if you haven't been in a while because it's so important to know how your oral cavity, because it's the image to your overall health. अगर हम इसको separate नहीं कर सकते. So there are many patients I diagnosed with pre-cancerous conditions कि आप do you take tobacco this and that, and then they had that pre-cancerous thing. So why not? मतलब I'm not saying कि ऐसा कुछ होगा, but you should be knowing your body.
Right.
So आपको जाना चाहिए if you haven't been there in a while. And don't practice that charcoal whitening and this and that. Start following a basic fluoridated toothpaste. और अगर कुछ जरूरत होगी तो your dentist will advise you.
Right. So the point which we are saying कि बहुत सारी toothpaste भी तो आजकल है ना, charcoal, active, like without taking names, I think we should address that issue also. For a person, how they should select that sort of toothpaste जो उनके लिए best है.
As I told, fluoridated, something that has anti-cavity component in that. then it should not be abrasive.
But इसमें ये भी तो चीज है ना, like for some brands they put the name like this and then they star it out like the name is for marketing purpose only. Like should the
नहीं,
person
so
go
so
towards
the
ingredients?
fluoride में क्या है, you should be seeing जो fluoride पीछे लिखा होता है, and that's not a lie because it's a component. When they there's a standard कि जितना उसमें लिखा है उतना होता है.
Right.
So that for adults it should be 1000 to 1500 ppm.
Okay.
Parts per million. For kids it should be lesser, like at 6 kids should can start brushing with adult, but उसमें थोड़ा सा आप कम कर सकते हो. For the younger kids उसका concentration अलग होता है, like 350 to 550 ppm. वो age पे थोड़ा depend करता है, and then the amount you are using उस पे depend करेगा. एंड एब्रेसिव की बात करें, जैसे मैंने बताया कि जितने भी हर्बल या आयुर्वेदिक नाम से टूथपेस्ट बिकते हैं जिसमें हम कहते हैं कि फ्लोराइड नहीं है, एंड वो दे आर वेरी दे हैव दैट पार्टिकल थिंग. आपको तो पेस्ट फॉर्म में ही लगेगा, बट दे हैव दैट एब्रेसिव कंटेंट इन देम. तो और दंत मंजन, प्लीज बी अवेयर ऑफ इट. दातुन,
मेरा नेक्स्ट क्वेश्चन ये आने वाला था कि दातुन, लाइक पीपल यूजुअली से कि टूथपेस्ट तो करना ही नहीं चाहिए, वट एवर इट इज, यू शुड गो बैक टू योर रूट्स इन अ वे कि आप दातुन करो. तो व्हाट इज दैट सिनेरियो? लाइक व्हाट आई फील इज लाइक ट्रेंड्स चेंज, लाइफस्टाइल चेंज, लाइफस्टाइल के हिसाब से वी हैव टू चेंज आवर हैबिट्स टू, राइट? सो दातुन आज के टाइम पे भी रेलेवेंट है कि नहीं?
देखो दातुन, it's a good thing. It has medicinal property. It has antibacterial property, and you can't deny it. There are neem ki, babool ki, miswak ki दातुन, है ना? And people, what earlier I've seen my Nana ji used to do is he used to brush, he used to chew on his walk, and he used to brush जो उसका bristles बन जाते हैं, and वो brush करके, and he was like कि मैं तो नहीं टूथपेस्ट कर रहा, एंड ही वाज प्राउड ऑफ इट. I don't know how his hygiene was. I was not a dentist then. But now what I would suggest is don't replace it with the toothbrush. Take that medicinal effect if you want to chew it for some time. But do your brushing and flossing as routine. And उस जो bristles and दातुन के उसको अपने teeth पे नहीं घिसाओ. It will cause वही enamel loss, gum loss, है ना? तो उसको रिप्लेस नहीं कर सकते कि दातुन कर लिया एंड वी आर नॉट डूइंग ब्रशिंग नाउ.
Okay, so it's not a replacement. It can still be used.
It's an add-on.
Right. And at last, like to the audience, what is that one thing they should do apart from like going from dentist, of course, they should do at their home जो बच्चों के लिए भी बहुत ज्यादा काम आ सकती है चीज?
Like brushing twice, flossing.
Flossing for kids as well?
Flossing for kids, yes, obviously, because जो जब हम kids as in जो 6 years plus हैं, वो तो they are obviously they are moving in to adult phase. They have permanent teeth coming up, so you need good care. But flossing can be tricky for kids to learn, so that way I'm saying कि आजकल flosser भी आ गए हैं, water flosser, and if you will incorporate that habit, kids will also be. But you have to learn that eventually, and you need, I think, a good guidance for that. How do you do it? But if adults won't be doing it, how the kids, some things are habit forming. हम ये नहीं बोल रहे कि, मैं पर्सनली फील करती हूँ कि मैं ये नहीं बोल रही कि 6 ईयर 7 ईयर या 10 ईयर का बच्चा बहुत अच्छे से फ्लॉस कर रहा है, उसको पता ही हो. बट if they will see you, they'll make a habit maybe in a longer run, and they are doing it. They are doing the night brushing if you are doing it.
Right.
My daughter, she doesn't sleep without brushing at night.
So thank you. I think it was a great conversation. It was a real and honest conversation, I would say.
I felt so good. Thank you for having me. It was like कितना time हो गया, and
yeah, we haven't took a note of the time, right? But I think it was really valuable for the audience. They would learn a lot, and I really recommend, like if they need any sort of advice and counseling, which I rarely hear from a dentist. Like you do oral counselings, right? That is the best part to start with. Like even if you need treatment or not, like you should have a counseling at least, and you should have an advice for that, right? So if they want to meet you, if they want to have a booking, appointment booking with you, I think we'll mention the details over here.
Sure.
So they can visit you, right?